Hello, my name is Daniel Corbin. I'm BSN 246, and today I'll be doing the insertion and discontinuation of a peripheral IV. For my video, I have a 20 gauge 1 inch needle. I have a flush. I have a set of clean gloves, some IV tubing, my IV start kit, sharps container, and my patient. To start my video, I'll enter the patient's room, closing the door behind me for patient privacy, performing hand hygiene, introducing myself to the patient. Hello sir, my name is Daniel, I'll be your nurse today. Can I get your first, your last name and date of birth please? Check the patient's wristband for 2 patient identifiers. Well sir, my name is Daniel. I will be performing an IV on you today. The doctor's orders IV fluids. Do you have any questions before I get started? No? Great. Start by donning on this pair of clean gloves. My supplies ready. I have a tourniquet, my Tepoderm dressing, alcohol swab, tape, and 2 pieces of gauze that I'll use for later. Discard that. Now, attach my flush to my IV tubing. And prime my tubing by just pushing a little bit of fluid through until I get a couple drops on each side. So, I can clamp this and leave it off to the side. Okay, now I want to assess my patient's forearm. In general, I'm looking for any lesions, scarring, fistulas, anything that can impede my access for an IV. I believe I see a vein that is adequate. So I will apply my tourniquet 4 inches above my preferred site. Generally it's about 4 fingers. Mr. Smith, can I borrow your arm, please? Thank you. When I'm applying the tourniquet, I want it tight enough so the veins pop, but not tight, not too tight, to where they lose blood flow. Great. I will now check for distal pulse, making sure there is a peripheral pulse. Which there is. Great. I'll now take my alcohol swab and clean my preferred IV site in a circular motion going from inside to out for about 30 seconds. Okay. I'm ready for my needle. Letting that dry. Now I have a 20 gauge needle solely because I am only giving IV fluids, so this is an adequate size. Take my non-dominant hand, using my thumb to tout the skin, bevel up. I'll insert my needle in about a 10 to 30 degree insertion, inserting into the skin until I see blood flashback. Once I receive blood flashback indicating that the needle is inside the vein, I will insert the needle another 1/4 of an inch. Okay, and from there I'll use this to loosen the stylet. And pull this needle out. Great. Now I'll take this, press the button, place it into my sharps container. Discontinue that. I'll take IV tubing, insert that, clamp. Now I'm going to aspirate for blood. Let's see that. Great. Now I'm going to flush inside. And at this point, I'm looking for any bleb indicating that the vein has blown, any discoloration, redness, anything indicating that I might have to redo the IV. However, this is a clean, easy, non-resistant flush. So it's right there. I'll clamp this. To my IV. There we go. Discard that. I'll take my. At this point, I would put a lure lock on to keep my site sanitized. With this, I'll put on my Techoderm. Okay. Alright, and then bending this around, taping to the patient's forearm. If I can get a piece of tape off this thing. Oh my goodness, there we go. Okay. At this point, I will date, initial, and writing down the gauge, the length, and the time that went in. Okay. Alright, I will gather any extra supplies and discard them. Removing my gloves, performing hand hygiene, documenting my procedure. For discontinuation, I'll enter the patient's room, closing the door behind me for patient privacy, performing hand hygiene. Well, Mr. Smith, the doctor is discontinuing your IV, so that means I can take out your IV and prepare a discharge for going home. Do you have any questions? No? Great. Gloves. And my gauze ready. Okay, and slowly taking off my dressing. Okay, I'll take a piece here. Put it over the top of the IV site, slow and steady, taking out the catheter. Okay, pushing that for about 30 seconds. I'll take the tape off this side, move it there. Once it's about 30 seconds, I'll put a new piece, a fresh and sterile piece of gauze. Once bleeding is stopped, over the top here. Tipping that down there. Grabbing any extra supplies, placing this into my sharps container. Any extra trash. There's some gloves. Performing hand hygiene. Document my procedure.